Hey gang, I hope you're doing well. What I wanted to do today is I wanted to share with you a single tip that will make you stand apart from every single classmate, every single other optometrist, optometry student out there, and the vast majority of optometrists with regards to ways to crush it financially, but also to set yourself apart when you go to look for a job. And that is that on your afternoons or the days where you currently do not have a laboratory or have something else going on, I would encourage you to go and ask a local optometrist who you trust if you would be able to follow their optician for a couple of hours. And when you go and you meet with that optician, what I would recommend that you do is ask that optician, what are some ways that you feel that the practice has made the most money in the optical? And what you'll find out is really surprising. On average, actually, the average practice has 61% of their revenue coming in from the optical and from contact lens sales. That is a significant percentage of the overall revenue that we're making in our practices. And if 61% of it is coming in from the optical, we need to understand as practitioners who are getting out there how to maximize that. One of the ways that we can do that is to understand how to prescribe multiple pairs of glasses for our patients. Not just to make more money, but most importantly, to make sure that we're meeting the demands and the needs that our patients have. So as an example, today I had several patients in the office who we prescribed 2 or 3 different pairs of glasses to. And that may seem like it's a lot, but every single patient needs, number one, their standard everyday pair of glasses. Most people also need some sort of glasses that they can use for occupations, whether they're on a computer all day or maybe they have a hobby where they do. A patient I had today did a lot of bird watching. And one of the other things that every single patient needs is a prescription sunglasses. Prescription sunglasses are really cool because they stand apart, and I kind of think of them as the optometric drug, that once a patient has tried them, they'll never go back to not wearing sunglasses or not wearing prescription sunglasses at that. So just a couple recommendations and some ways that you can stand apart is get out there and figure out from opticians what they feel is really, really setting their practices apart that they're in. It's difficult to ask the practitioner that because a lot of practitioners out there don't know what's going on in their optical. It's one way that you can set yourself apart. And if you don't have a good relationship with a lab, ask your own school, if the optician, and go into them and say, hey, I know I'm going to go through some optical classes when I'm here at the school, and I know I'm going to learn some, but I'd like to spend an extra day with you just learning some things. Not many of you are going to actually follow up and do what I'm recommending that you do. But for those of you who do, I think when you graduate and you get out in optometry and you go and look for a job, you'll have those key aspects that you can talk to a practitioner about that'll make you stand apart and will set you aside for greater opportunities. So I wish you the best of luck.